Welcome back to WIS News Primetime. Tonight we are discussing a future resource for stroke survivors in the Midlands, which will provide opportunities for connection building and rejuvenation.
The Retreat and Refresh Stroke Camp offered by Prisma Health will also offer educational sessions and discussions for those who have suffered a stroke. Joining us tonight to tell us more is Dr. Coda Murray with Prisma Health. Thank you so much for joining us.
Of course. Thank you for having me here today.
Absolutely. I mean, this is a really neat program and idea. So kind of tell us a little bit about the inspiration behind it.
Yes, so again, stroke recovery is a complex process, right? So it involves like identifying the cause, like trying to treat the cause, right? So it does not end there. So it's a whole lot to take. A person's life has paused right there after the stroke. So they have to connect back to the society. They have to come back from that stressor. So a stroke camp like this offers a lot of opportunities for them to collaborate with like similar stroke survivors, right? Similarly, like, caregiving for a stroke patient is a lot, right? So there's a lot of stressful, it involves a lot of stresses, right? For them to come back and connect with other people going through this and share similar ideas. So a stroke camp offers a lot, right? One thing is a community building where they feel like they have a belonging, right? So the other thing is connecting them back to their social life, right? And the other thing is trying to identify a similar, some strategies that work for other people, right? And also for caregivers, it is like a respite, right? So they come back, they relax, so they don't have to worry about their day-to-day activities, right? So it's a 2-day camp. It will be on May 16th to 18th.
Okay, all right. Well, and I think when it comes to a stroke itself, sometimes people don't realize that they're having one. What are some of the things to look out for in terms of like some of those key warning signs?
So very good question. So a stroke is like a hyperacute, which means it happens like in a fraction of a second. Any loss of activity, right, and any loss of function should be considered a stroke. For example, ability to talk, ability to like walk, ability to balance, ability to see. So there's an acronym like be fast, like balance, right, lack of balance, like E stands for like eyes or vision, lack of vision, right, face drooping, or arm weakness, right? So it's difficulty talking like S, and T is time. Like stroke is very time sensitive. When you see sudden loss of function, then it's time to call 911.
Yeah, because time really is of the essence in a situation like that. It can make a huge difference in recovery.
Exactly, right? I mean, right now we are in a situation where we are able to help a lot of patients if they present to the hospital in specific time frames. So recognizing stroke is a big thing. Like going to stroke camps or something like this would also help in education to the community, because it's not only for stroke survivors, but it is also for our stroke caregivers and other family members.
Okay, so I want to ask you about that and how you open it up to the caregivers, and kind of tell us about why that is important to really have this resource for them as well.
So it's like caring for a stroke person, like I just mentioned, it's very complex. Like understanding, like going through what they are going through, right? Seeing other people like come and talk, share their experiences would help, right? And other thing is trying to, because not every stroke patient is the same, right? So they have unique needs, right? Coming to conferences or camps like this, they'll get some kind of an education specific to care for these stroke patients. So that's very important there.
Yeah, how many years have you done this, or is this like a first time new initiative?
So this we have been doing for past few years. It's like a community give back thing, like what Prisma Health does for community. So this year it's going to be in North Carolina, Camp Conuga.
Excellent. And I imagine that you're hearing from some of the people who have come in terms of family members and whatnot, just the benefits to being in a community like this.
Definitely, again, it speaks for everyone who attends last year are coming back, right? So it speaks for a lot, right? So it has to offer a lot, right? So we have a lot of activities involved here, fun-filled activities, educational opportunities, they can just relax, not care about anything, right? So it gives a lot of satisfaction to people, both for the caregivers and stroke survivors who attend camps like this.
Yeah, I like how y'all said it's rejuvenation for kind of both parties involved, and I know it's also very educational, like you said. You're learning a lot of important information, but just kind of the key takeaway, if someone who is attending was going to walk away from the camp, what would be something that you hope they take with them?
One thing is they get good relaxation, right? And they feel like there is a belonging, there are other people, it's not that they're isolated, right? So those are the things that they would feel connected.
Yeah, all of that making such a big difference. We have some information for you about the Retreat and Refresh Stroke Camp that's happening May 16th through the 18th, happening at Camp Cayuga in Hendersonville, North Carolina. $100 per person to register, and you can get more information Prisma Health's website and that number right there on your screen. But thank you so much, Doctor. We appreciate it.
Thank you for having me here.
All right, well, stay with us because we have more prime time coming up after the break.